The Answer Desk is looking at booster shots. A lot of questions out there. Will you need one? When can you get one? The Biden administration now working on plans to make booster shots of the Pfizer and Moderna vaccines available to most Americans.
Right now, they are only approved for some people with weakened immune systems. So who else might need one?
Vaccine protection wanes over time. So I think when we're looking at prioritization, it's really going to be those who were vaccinated in the earlier phase.
And Channel 3 Eyewitness News reporter Mike Savino working on this story for us today. He joins us live from the Answer Desk. Mike, who else might need a booster shot?
Well, Courtney, that's one of the questions that even doctors still have. Now, Pfizer has been doing a clinical trial, and they just gave some data over to the CDC today, but those trials are still ongoing. Studies have found that among the elderly, we didn't see the boost to the immune system that we wanted when they got the shot. Other studies are showing higher rates of infection among healthcare workers. So doctors are wondering, is there something specific with these groups of people? Or is it possible that the vaccine is waning over time as antibodies disappear? Doctors say it could be that we're seeing several factors here, as well as the Delta variant spreading. So we do have to study which of those factors is driving this new increase.
Obviously, this big news also brings about a whole lot of questions. What kind of timeline are we looking at before we see more people getting booster shots? And also, are there certain approvals needed, or is it something that you can just walk in and get the shot?
Well, we are going to need to see approvals from the FDA and the CDC, just like we saw last week for those booster shots. And right now, Pfizer and Moderna have not yet applied for that. So we're likely still a few weeks away. Now, in terms of rollout, doctors are saying that those tests that I just mentioned are crucial. We need to see who needs to be targeted. We should be targeting vulnerable groups. Does that mean those who've got the vaccine earlier, people with weakened immune systems, the elderly, who needs it? We also need to make sure that we're being strategic here, because the priority still has to be getting shots to the unvaccinated, both here in the U.S. and in other countries. So giving a third shot to people is a shot that you can't give to someone else. I'll have more on what doctors had to say coming up on Eyewitness News at 5.
Forward to that. Mike Savino reporting for us this afternoon. Mike, thank you very much.